Hi, thanks for joining the Art of Mindful Healing video series. I want to talk today about a powerful, powerful word, and that word is transition. For some people, the transitions are some of the most difficult times in our lives, whether we're transitioning in jobs or locations, and it certainly happens when you're transitioning after illness. However, I think some people don't consider that there is a transition period. They may hear, okay, treatment's over, and I'll see you in 6 months or a year. And they're left feeling, okay, I'm cured. And then they leave and they get out into the world again, back into their routines, and an unraveling can happen that really catches people off guard. And this is common. Transition is a necessary part of the cancer experience, of an illness experience, and it's really important to process it. Many people refer to these kinds of things as a liminal period. Liminal means no longer and not yet. So you're no longer a cancer patient because your active treatment is over. And this could be confusing for people who are doing medications such as breast cancer patients, people who need aromatase inhibitors or estrogen blockers. It can feel like you're still in treatment. And for some of those people, you can be on these medicines for 5 to 10 years. So that's confusing. They may feel like they're still a patient, even though they're not regularly seeing an oncologist. So there's the no longer in active treatment, and then there's the not quite to the next period. You may not feel like you're fully finished with this experience, and that is a liminal period. And the messy middle that many people often use to describe periods of transition can be very difficult. So it is very common for people to feel like this is over. However, I don't feel like it's over. What's wrong with me? And anybody who has had chemotherapy, radiation, these very invasive treatments, you don't just get over it. It's not over when it's over. And so I just want to be very clear about allowing yourself the space to process. And that may be some time, and that may be some extra resources like counseling or classes at your cancer institute, or taking up yoga and getting back in touch with your body. There's a number of things you can do. One of the things that I use in my work that I've found very effective for people is to find some sort of ritual, a ritual to help them say, okay, I am now transitioning. And it can be something as simple as this. I often suggest that people write a breakup letter to cancer. So write your letter, get out all those feelings, and say, I am trying to break up with you. I am moving forward. So try that exercise as a tool and see if it helps. Thank you for joining, and be well.